Hi, welcome to CAN TV. My name is Michael Beal. I am a claims representative from Social Security Administration South, and I'm here with
Nicole Joseph. Hi. This is Michael's first time, so
Yes,
he's
so-
excited to be here.
I am.
And he was trying not to give out his field office because he didn't want everybody coming to his office, even though he's pretty popular because he knows what he's doing, he's very intelligent, and he knows his Social Security back and forth.
Yes.
So he was trying to figure out if he should give out that information. But if you want to get in contact with us, we can easily be reached at our national number, which is 1-800-772-1213. And what they'll do, they'll find the local office for you and even answer any kind of questions that you have. So let me go back to introducing myself. I'm Nicole Joseph. I am a public affairs specialist with Social Security. And welcome to CAN TV. We're here every Wednesday from 4:30 to 5:25 until December 18th. So please tune in and please call us. Our phone number is 312-738-1060. That's 312-738-1060. This is a live show. So now back to Michael.
Hey, thank you for that. I appreciate that. I was just here. I wanted to tell you that for more than 80 years, Social Security has been there to help people throughout their life's journeys. We're there when you are firstborn. When you're firstborn, you're given a Social Security number. And we're there when you are getting your first job. Because when you get your first job, most of the time you need a Social Security number or a card to present to the employer. And you have to come to Social Security to get that card.
That is correct.
Yeah.
And here's the thing about when you first start working, which is interesting. How many people, when you got your check, it looked like this? Let's have you hit the web PC so they can see what I'm talking about. You see FICA there? And you got your check and you were thinking, why is my check so little?
Yes.
FICA, that is us. That is Social Security.
Yes, it is. And we're there in many other ways, too. We're there when you are, if you're a young lady, when you become married and you want to change your name to your spouse's name, you have to come and visit us at the Social Security office with your marriage certificate and picture identification, and we can change your name.
Yes, and we can, though. That is one of the options. So here's the thing. How do you want to do this? We'll just kind of go through. We have some information up here just to kind of give you some of this information. If we're looking at, like, for example, FICA taxes. This is what we did for 2019. If you hit the web PC, it'll show that 7.65% your employer matches, and you pay into it a total of 15.3%. And that's between you and your employer. And pretty much this is how we fund your benefits. So this will be for your retirement, for your disability, and for children's benefits.
All right, yes. And we're there after you've been working for a few years and you're unable to work because of some disability or some alien condition that you have, Social Security is there with disability benefits for individuals who have worked 5 out of the 10 years prior to their disability.
That is correct also. So we are here to help people. And I think the topic, we wanted to really work with women, being a woman myself. So how about this? Let's kind of go through and let's talk about the building blocks. Because I know here you said that you need 40 credits.
Yes.
So let's see what that looks like.
40 credits. That's 10 years of work, and one credit is $1,320 in covered earnings. So you get 4 of those in a year. So no matter how much money you make in a year, you can only get 4 quarters in that year.
I can only get 4 quarters.
Unfortunately, that's the case.
What?
Yes. Okay, and of course, Social Security does not want to miss your retirement. And we're there for, especially for the women, because that's who we're speaking to today. Especially, these are things that women should know about, Social Security in their life and how we're there to assist. So in retirement, basically, a woman, if you have earned your retirement, regardless of what goes on in your relationship, if you're married or if you're divorced, you're always eligible for your own Social Security benefit.
Now that's true. Now let's see here. If you are retired, and how early can you start getting benefits?
Well, you can start getting benefits as early as age 62. If you're a widow, you can get benefits at the age of 60.
Okay, and let's see here. So to collect your retirement benefits, you can start as early as 62, or you can wait to your full retirement age, or you can wait to age 70, which is when you max out. And this is what it looks like, the chart. So if you look in the first column, you will see your year of birth. Then if you look in the next column, you'll see when your full retirement age is. And one of the things that I know with your full retirement age, anytime you collect benefits before your full retirement age, what happens?
It's going to be reduced.
Yes, reduce, and you're going to have an earnings limit also.
Oh, yes.
There's going to be a limit to how much money you can make.
Yes.
So that's why whenever you are, especially as a woman, if you're going to decide to take benefits, you need to discuss with either someone at Social Security or go online where we have a wealth of information. And you need to decide when is best for you to collect your benefits. Because if you wait to your full retirement age, then your benefits are not reduced. If you wait to age 70, your benefit increases about 8% a year, but it maxes out at age 70. So as a woman, these are some things that you have to think about.
Yes, indeed. And some women who are homemakers, women
Yes.
who have not worked, you're eligible for benefits as well. At 62, you're eligible for about 33 or a third of his Social Security benefit, and it goes up to full retirement age. At 66, you can receive up to 50% of the spouse's benefits. So Social Security is there for those who are not working, but taking care of the household as well.
Yeah, now this is true. Because a lot of times, let's stop one of these myths that's out there. Because I think sometimes people think that if their spouse hasn't worked, that they automatically are going to get immediately half of whatever their spouse would get at their full retirement age. So the only time you get exactly half as a spouse is if you wait until your full retirement age. Because remember, anytime you collect benefits before your full retirement age, your benefits are reduced.
And it is important that if you are a woman who is going to remarry, that you apply for your benefits, the higher benefit prior to marriage, because once you get married to the new spouse, you're kind of locked in, and
Yes.
you can't go back to.
So those are
See if
things
you're
that
eligible.
that's right, you have to consider that. And then another thing you have to think about, if you're a divorced spouse, say you were married for 10 years or more, and you got divorced, you're eligible for benefits based off of your divorced husband's or your ex-husband's record or ex-wife's record. And the way we determine if you are due these benefits, we're going to look at what your spouse or ex-spouse would have gotten at their full retirement age. We take half of that. And if half of that is more than what you get at your full retirement age, then you are due an additional amount.
Yes.
But if what you get at your full retirement age is more than that half based off of your ex record, then you're not due any
And-
benefits based off of that record.
And you cannot get both benefits.
No. Some people do believe that you can get both,
Yeah.
but you cannot. You
Yeah.
can only get one or the other.
Yes.
And we always go with whichever one is the highest. Now, I do know we were talking about survivors'
And we're
benefits.
talking about survivor benefits as well. We're there, and when a spouse passes away, there's a one-time payment that is given to that widow. It is a $255 one-time payment. It's called the lump sum death payment.
Yes.
Kind of.
Yeah. It's
But-
$255, yes.
$255, and as well, you can receive survivor benefits.
And you can receive survivors benefits as early as age 60. But just like we said before, anytime you collect benefits before your full retirement age, your benefits will be reduced. So if you collect at age 60, you'll probably get about 71.5% of whatever was due to you because you're collecting early and you're going to be collecting it for longer. And also, with survivors benefits, you'll need to bring in like an original certified copy of your marriage certificate, just so we know that you were married.
And you have to be married for at least a year in the event of death. So,
Yes.
unless it's something like an accident or something. And then in that event, the marriage can be in 9 months. So, again, Social Security is there to assist when you need us.
That is correct.
Okay.
We are there.
Can I go?
Yeah.
Also, I want to just quickly say, if you have children, for in the instance where there is a widow and she has children that she has to take care of, the children are eligible for benefits as well. The children have to be under the age of 18 and in school.
Okay. So let's see here. This is some information about children, just like you said.
A parent who is disabled or retired and entitled to Social Security benefits, or a parent who has died after having worked long enough in a job where they paid Social Security taxes. And then the children, like we said before, they must be unmarried under the age of 18 or in school and all of that.
Yes,
So
exactly. So we look out for our children too,
yes, we do. And this
especially
is-
if you paid. Oh,
All right, we got a caller on the phone line.
let's see. You want to hit the YouTube so they can see us?
All right, caller. Are you
Yes.
there?
Yes, I am. Yes, I was calling. I filed my benefits last month, but I won't turn 62 until December. So I was just wondering, how soon will I receive my first check? And I understand that you also work with use of the benefits to this bank called Core America. Is that also true?
Okay. Well, yes, if you turn 62 in, you said December, you would probably be eligible for benefits as of January, because it's the first month that you're 62 for the entire month. And Social Security pays all benefits 1 month behind, so you would probably receive your first payment in the month of February. And for individuals who do not have their own bank accounts, we do have what we call a Direct Express, which is a
Yes.
program that we're affiliated with where you can have your monthly payments deposited.
Thanks, sir, for calling.
Yeah, that was interesting.
That was a great
Yeah.
question.
Yeah.
Yeah, and that's one thing people don't know. We do pay a month behind. And we also pay based off of your day of birth, especially if you're getting retirement benefits. So you'll either get paid the second Wednesday, third Wednesday, or fourth Wednesday of the month
Yes, yes.
based off of your day of birth. Because I know sometimes people come in and they're like, I thought I would get paid on the third. And you're like, no, that has changed.
It's changed.
There's
yes.
so many people now. We had to stagger those dates. Okay?
Yes. So also, we also are there in the event that you are going to have to receive, what is that, SSI. Now, SSI is a benefit for individuals who have a disability but who may have not worked the 10 years or 5 or the 10 years just prior to a disability. And we don't want to leave them in the cold.
Yes.
Yes, indeed. So, as well, we have benefits for them. It's a lot less than most people probably would receive for those individuals who have worked and paid into the Social Security system. But again, it keeps them above the poverty rate, and it is a great assistance to many people around not only the Illinois, but around the country. Each SSI program is run by the state. It comes through the Social Security office, but they're all run through the state. Do you have any information on the?
Well, we could talk about the difference. Well, we have like two disability programs. Just like you said, we have one program that you pay into. So whenever you get quarters of coverage, and we were talking about your FICA taxes, things like that, that's paying into your SSDI disability.
Yes.
And that's when you said that you have to have worked the last 5 out of 10 years in order to be eligible for the SSDI. You have to have something, a disease or terminal illness or something so severe that it lasts 12 months or longer and may result in death. And then that information is sent down to DDS once we get everything, and then they're the ones that make the determination. So SSDI is the one you pay into. SSI is the need-based one, and that's where we'll look at your income and your resources that you see on this chart here. And it tells you about the differences between both.
Yes. And also, I just wanted to give another thing. Social Security, we figure everyone's benefit the same, no matter who you are. If you have worked, we figure out your benefit, and it's based on a monthly based rate, and we take the highest 35 years. And for any individual who has not had 35 years, for any of those years that you do not have any earnings, we make that 0. So for an individual who has worked more years, he would receive more in Social Security from an individual who may have not worked as many years, because we do have to fill those years in with zeros.
Exactly. So high 35 years. So if you ever hear someone say, oh, Social Security only looks at your high 5 or your high 3, that's not Social Security. That's probably your company. That's
exactly.
not us. We do high 35 years. So sometimes people come in and they're like, why is my Social Security so low? And you're like, you look at it and they have years where they did not work.
Yeah.
Or they weren't paying into Social Security. So those are zeros. So whenever you average in zeros, if you remember from your math class, it kind of brings you down a little bit.
It brings that average down a little
Yes.
bit. And for individuals who are over the age of 65 as well, we have Social Security benefits for individuals who reach 65 and have not worked, and that is the SSI. And they don't have to have any kind of disabling condition or anything like that. There may be financial guidelines that go along with the program, but it's there for individuals who do not have enough work and who are over the age of 65.
That is correct. Absolutely correct.
Yeah, so we have a lot of good programs at Social Security.
We do.
Yeah. Okay, so as well, when you're receiving Social Security, if you were a government employee, if you were someone who has worked for a city, state, county, or federal agency, when you retire, you can plan on that having an effect on your Social Security benefit. Some agencies only pay into Medicare, and and it's funny, a lot of people will come into Social Security right before retirement and look and see what they're eligible for and find out that that city, state, county, or federal job was only paying into Medicare.
Yes, yes. So that's why it's always good to have a discussion with your employer, because a lot of times some people come in and like, I didn't know we weren't paying into Social Security, and you're like, yeah, you all weren't paying into it. So always have a discussion with your employer and find out, are we paying into Social Security? And then this is how Social Security, well, we have two programs. There's the windfall elimination provision, and that will affect your own Social Security.
Your own Social Security, yes, indeed.
And then there's the government pension offset. That will affect if you're trying to get spousal or divorced spouse benefits. And you see our website there. We have a wonderful website with so much information, socialsecurity.gov/planners/retire/web-or.html. Wonderful website.
And one good thing about the windfall elimination, if you have worked and paid 30 years into Social Security, you can also receive your full Social Security and your government pension without any kind of reduction.
Yes.
And that's a good thing.
But here's the thing. When we say
Caveat.
30 years,
Well,
yes, exactly.
yes. 30 years you paid into FICA.
30 substantial years is
yes.
what we're looking at. So that means that for 30 years, you would have had to have paid into Social Security a certain amount. And we have the chart on our website. You can go right there.
Yeah.
And then pull up the windfall elimination provision, and it will show you for each year how much you would have had to pay into Social Security to get one substantial year of earnings.
And for the government pension, yeah, that applies when you're receiving a non-covered pension and filing for a spouse's benefits and the widow's benefits. And a lot of times that could reduce the benefit to absolutely zero. And that's a very disappointing thing sometimes too as well when the people come
Just
into
a
the
little.
office. Yeah.
But the great thing about it, if you have paid into Social Security and you did get a statement at one point in time, or you do see something where you are going to collect Social Security, if you do have a non-covered pension, you will get something based off of your record.
Yes, off of your own
You'll
record.
get something.
Yeah.
So that's a good thing.
A lot of times it's just enough to pay for Medicare, but a lot of people are really happy with just that happening. So,
Yes.
yeah, that's a good thing.
Definitely.
Yeah. All right, so you have any other things we want to discuss here today about Social Security?
Oh, well, let's see here.
So much information to give to the people.
We do have a lot of information.
Especially since we were talking about the government pensions and like for teachers, those are teachers, police officers, judges, and all those people who work in that field. Sometimes it hits you really, really hard.
Oh, yeah, definitely.
Yeah.
Definitely. So let's see here. We also have other benefits. With Social Security, we have Medicare. Medicare begins at age
65.
Exactly. And so normally you apply for Medicare 3 months before you turn 65. And that's if you're not, 3 months before you turn 65. But if you're working and you are covered underneath your employer's group health insurance plan, or you're married and you're covered underneath your spouse's, and your spouse is working and you're covered underneath your spouse's group health insurance plan, you don't need to sign up for Medicare Part B as in boy, which is the part you pay for. You can just get Part A, and then when either you retire or your spouse retire, you can sign up for Medicare Part B then.
And for individuals who are receiving disability benefits, you can get Medicare after 2 years of your entitlement to disability.
This is true.
So, and the cost for Medicare usually goes up.
Oh, yes. Actually, I think it did go up this year, and I thought I had the printout, but I guess I don't. I think it went up to like $144.
Yeah, I think that is it, 144.
So, and it was in 2019, $135.50. So, if you want that information, you can go to www.cms.gov, www.cms.gov to get the information about the current rates for Medicare.
And for Social Security individuals, they get a 1.8% raise this year.
Ooh. See, you're giving them a lot more. It's like only 1.6.
Is it 1.6?
It's just 1.6.
I'm sorry.
I mean, that's okay. Because here's the thing. It looks like it'll be it averages out to about an additional $24 a month.
Okay.
So you get a little something. Who doesn't like a little something?
Yes, that's nice.
Yes. Start the new year off.
And if you want to give us a call here at the station, it's 312-738-1060.
Yes.
We're here for any questions that you may have.
Okay, so now let's see here. Now there are other programs. So if you're not eligible for Medicare, if you're not 65 and you're not disabled, you can qualify through the state, possibly for Medicaid. And that is a state health insurance program for people with low income and limited resources. And in most states, children who get SSI qualify for Medicaid, and in many states, Medicaid comes automatically with SSI eligibility. So these are things that we just want to make sure that everyone is informed of. We do not do Medicaid at our office. We only do the Medicare. Okay, so don't come in our office talking about, I want to get Medicaid.
Yeah.
That's not us. That's through the State Department. We'll sign you up for Medicare.
And when you're receiving Medicare, if you have Social Security, they deduct that premium from your Social Security benefit. So to ensure that you're always covered with health insurance.
Yes, exactly. Exactly. And which is great because if you're already signed up for your Social Security benefits, your retirement, you don't have to do anything. You can sit back and get your Medicare card in the mail because you're already signed up. You're already in our system. So if you sign up with retirement Social Security prior to you age 65, you'll receive your card automatically in the mail. Isn't that nice?
That is nice.
You don't have to do anything, okay? Except give us a call. This is a live show. This is 312-738-1060. Come on, call us.
Again, with the survivor benefits, another thing I wanted to point out is that if you have children or if you're a woman who has children, the children can receive benefits, and if you are not working, you can receive benefits as well for taking care of the children up until the age of 16. Mm-hmm. And the child can receive benefits until the age of 18, as long as he attends full-time school.
That is absolutely correct. And then here's another provision. Like if a child is turning 18 and they were collecting SSI based off of your record prior, what'll happen is they'll make a... Did you want to take over?
No.
Okay, Social Security will make a new disability determination using adult rules, and they'll no longer count the income and resources of the parents for eligibility. Mm-hmm. So if the child continues to live with the parent but does not pay for food or shelter, a lower SSI payment may apply. And an SSI application can be made as early as the day of the 18th birthday. So always remember that. If your child is turning 18 and, we need to make a new disability determination using the adult rules.
Mm-hmm. And if you're receiving retirement benefits, your child can apply for benefits under your Social Security number.
That is correct. Mm-hmm. So when you file your application, what happens is they'll ask you, like if you have any children. When they say children, they always mean under 18 or someone that was considered disabled prior to age 22. Mm-hmm. So if you list children on your application, you're going to either, if you go in the office, they're going to ask you about it. Or if you file online, you're going to get a call because we need to get more information about the children in your household to find out if they're under 18 or if they were considered disabled before age 22, so we can see if they're eligible for benefits. Mm-hmm. So part of our job is to make sure that you are getting all the benefits that you are supposed to receive. Mm-hmm. And that's why we looked through your application and we're going to make sure that you get everything that you are due.
Mm-hmm. And mothers, we want you to know that even if the father's name is not on the child's birth certificate, there are ways that you can still receive benefits for the child.
Ah,
yeah.
Really?
We have to do a little investigation, but the bottom line is we want to make sure that the legitimate children are paid benefits in the event that they do.
Okay.
Yeah.
Very good.
Yeah. Just had an instance earlier where a young lady came into the office and she didn't have the guy's date of birth or anything like that, and she didn't have the father's name on her birth certificate, and she wasn't sure if she would be able to get benefits for the children. So basically what we did was we contacted the deceased family and just made sure that they were aware or they thought that this child was related to them and he was related to the deceased, and took care of that.
Wow.
And it makes you feel good to know that you're doing that for the children.
Wow. Oh, and it looks like we have a caller.
All right. Caller, you there?
Yes.
What's your question?
Okay, my question is that I'd like to apply for SSI. I just turned 65, and I'm told that I can count on being turned down the first time that you apply. Is that true? That's the norm?
Okay, you said SSI. So you are applying for disability, and we have two different programs. We have Social Security Disability Income, and then we have Supplemental Security Income. Now, I'm not sure if every time when you apply, if they deny you the first time, but you can
Okay.
definitely apply. Doctors make those determinations. They use your medical records. You can submit information to help them make those
Well,
determinations.
I'm not applying for disability. You said the one, I just turned 65
Okay, so,
and I'm under-resourced
okay,
financially.
okay.
So that would be applying for that one,
Well, okay, so
the
did they not
supplemental.
inform you of the reason that you were denied?
No, I'm asking the question. I haven't applied yet,
Oh,
and I just was told that that's the norm, that when you apply, you can count on being rejected the first time.
Yeah,
Have
I
you
can't
not
say
heard
that
that?
that's really the norm, especially in your situation. It's a need base. So always apply. Okay?
Okay,
That's what I need you
okay,
to do. If you're going to
yes,
apply, do it right away because we're here to help you. One of the things
okay.
that they are going to look at, just for your information, they're going to look at your income, anything coming
Mhm,
in. They're going to look at your
mhm,
resources, cards, like if you have multiple cards, if you have multiple homes, if you have a
mhm.
401k. So there are things that they do have to investigate.
Mhm.
So
Understand?
my advice to you, it doesn't mean that you're going to get rejected the first time.
Okay,
Okay, don't
okay.
listen to
All right.
everybody. I would apply.
Yeah. All right. Thank you
Okay?
very much. I will. All right. Thank
Thank
you.
you.
yeah, I'm sorry. Yes, we do have SSI for individuals over the age of 65, like we stated a little earlier. So if you are, low income or you don't have many resources, like she said, that's the
Yes.
program you would apply for.
Yes, definitely. Don't ever hesitate. And I know there's a lot out there where people are like, they get denied the first time and then they get denied. No. Here's the thing. You have to apply. If you feel that you need this benefit, apply. And then great thing about our system, if you are denied, we tell you why you're denied. Maybe your paperwork wasn't in order. Maybe, there could be just so many different reasons, but you'll get a reason why. And then guess what? You have 60 days to reapply, to appeal that decision, to say, no, this is not correct. I really am disabled. Okay? So we're here to help you. So definitely, if you ever think you need SSI or SSDI, apply.
And in those events, the person who makes the second determination is different from the person who makes the first determination. And if you do not agree with that person, it can go all as high as to a judge. So
Yes.
we try to be as fair as possible.
Yes, exactly. And the interesting thing, when it comes to SSI, if you're over 65, it's a little bit different than if you're applying as far as being disabled. So we have another caller.
Another caller. Caller, you there?
Hi.
Hi.
So I was married to this guy for 10 years. We got divorced when he moved away. And I was basically just wondering, would my kids and I still get benefits from him? Because I heard that he passed away.
Okay. If he has worked for and paid into Social Security and you are of age and the children are under the age of 18 in school, or if they're over the age of 18, disabled and have not worked, they can possibly be eligible for benefits under his number.
Yes, exactly. So my advice would be file an application with your local office. You can call 1-800-772-1213. That is 1-800-772-1213 to get information. One of the things that we'll need to know about your ex-husband would be like their date of birth, because we'll have to kind of locate them in the system. And then we can go from there to do our investigative
Yes.
part. But you're going to have to help us out a
Yes.
little bit
Help us
with
help
some
you.
details, okay? Because you
Yes,
can't
we do.
just call us and say his name is John Robb, because there's a lot of John Robbs in the United States. So we just have to have some information so that we can locate the correct person
Yes.
and then go from there.
Yes. And we will try to help you. We have vast resources. So
Yes.
just come in, give us the information that's required, and we can try to help you as much as possible.
Exactly. So let's see here. I wonder, let's see, Rob, we have our tech guy. You think you can give us a video? It's not. So while we're doing that, because we have these wonderful videos on our website, and it talks about all the things that Social Security does. So our tech person is going to pull up some just so you can look at it. Because I think sometimes I know you like looking at us. Michael looks all sharp here. But we're going to bring up a video that eventually that you can look at so that you can see what we're about as far as Social Security. Oh, 5, 4, 3, 2, 1. Hit the web piece.
Through life journey from birth to retirement. As your life changes year to year, so do your needs. For over 80 years, Social Security has helped to meet your needs and is committed to improving access to the services that make a difference in your life. Today, you can verify your earnings, estimate your future benefits, apply for retirement, manage your benefits, and even change your address, all from the comfort of your home. Social Security's online services help put you in control with secure access to your information anytime, anywhere, allowing you to spend more time with family, friends, or simply just enjoying the day. Social Security, securing today and tomorrow. See what you can do online at socialsecurity.gov.
Produced at U.S. taxpayer expense.
Ah.
All right, and we're back. One thing I want to talk about real quick is something that I've been hearing a lot about lately, and I wanted to clear the air about, is some scams that have been going on. I had a phone call the other day. A young lady called and said that she had got a phone call from someone in Texas telling her that they found a car full of drugs, and if she didn't give them her Social Security number, that she was going to be arrested and her Social Security number would be suspended and all this. And I just wanted to say Social Security would never do or never give a call like that to an individual. And if someone did call you with information such as this, never give them your Social Security number.
Right. Now, the interesting thing, yes, there are so many scams out there. Now, understand, if you are doing business with us, if you have filed an application, we may reach out to you because we do need information. Just like I said before, our job is to help you so that you can get benefits. So we may reach out to you. But one thing we're not going to do, we're not going to threaten you. We're not going to suspend your Social Security number because guess what? It can't be suspended. We are not going to put you in jail.
None of those things.
None of those things. So the best thing to do would be hang up.
Yes.
Hang up the phone. So I know there are like 3 tips that we have on our website that we're supposed to do. What are they? You know those tips?
Yeah, they understand the threats, exercise caution, and secure your information.
Yes.
So those are 3 tips that are very important.
That's extremely important. And then this is other information that we kind of went over a little bit.
We do not contact you. Generally, those who have ongoing business with Social Security are the only ones that we would contact. And again, the information that we would ask is limited in terms of your privacy. So if it's something different from that, do not give any information. In those cases, those calls could be fraudulent.
Yes, exactly. Oh, and let's see here. The next thing we're going to talk about, how to prevent elder abuse and financial exploitation. Now, that's another thing. Working for a government agency, we always want to make sure that everyone is taken care of properly, and that if you ever see something, that you do speak about it. So I know that our website, let's see here.
The OIG website?
Well, here's the thing. One of the things you have to learn to spot some red flags. And let's see here. We're going to go back to this PowerPoint. If I could get over there.
That's not it.
Yes.
Thanks.
And then let's see here. We're going to go to slide 28. So, as you know, for more than 80 years, as Michael was saying, Social Security has helped secure today and tomorrow with financial benefits. And it looks like we
All right.
have a caller.
All right, caller, are you there?
Yes, good afternoon.
Good evening.
Good evening. I'm turning 65 next year, and I did receive my Medicare and some information attached to it. However, I also received some information in regards to Medicare prescription drug plan. Can you please discuss that and give us an overview of that? And I will hang up to hear your answer if you don't mind.
So you want information about the Medicare prescription drug plan?
Yes, if you can give us an overview.
Okay, well, here's the interesting thing about it. Let me explain what Social Security does. Pretty much, we just get you signed up for Part A and Part B. And Part A is the free, and that's if you're ever hospitalized. Part B has to do with the outpatient insurance and labs. So when you talk about the prescription drug plan, Medicare Part D is in dog, that you would have to deal with directly with Medicare. Now, we do have services. Well, I can't say we. There is an organization called the Senior Health Insurance Program. Let's see. Let's hit that webcam. The Senior Health Insurance Program, they can give you more information about the differences and what will work better for you. Like, especially if you're trying to figure out a supplement or a Medigap plan or anything to make up for whatever Medicare A and B does not cover. Contact the Senior Health Insurance Program. Their number is 1-800-226, and it went away. But the Senior Health Insurance Program is an awesome program. Go visit the website, and you can just put in SHIP Illinois. And like I said, the number is 1-800-252-8966, 1-800-252-8966. They have certified counselors there to help you navigate through all of this Medicare information. And guess what? It's free. And they're not affiliated with any insurance company, so they're non-biased. So when you're talking about the drug plan, I would say contact them, definitely, for more information.
And if you were talking about the with the prescription drug plan, we do have a subsidy that we take an application for. And that's based on your income and resources. But again, that's just an application that we take so that you can give that information to whoever you have as your provider, and then they would assess any kind of a discount or subsidy to that premium for your prescription drugs.
Right. We do have a Medicare Extra Help program,
Yeah, exactly.
definitely. So thank you, caller. That was a great.
That was
great. And so now, what we were going to discuss, we're going to talk about now how to prevent elder abuse and financial exploitation. So we have a chart here, and some of the things are learn to spot red flags.
Learn to spot red flags. There are a number of red flags, content uploads, or for elder abuse. Examples of this is isolation, especially by a caregiver, unpaid bills or utilities that have been turned off, unusual or quick changes in will or other financial documents, missing medications, and bruises or welts.
Okay.
Even if you're not certain about abuse, it is taking place, you can report any suspicious abuse to Social Security.
Okay. So you can report it, and let's see here. And there is a website.
Yeah.
And it is it's the https ncea.gov, and it's suspect abuse. There you go.
All right, thanks a lot.
And that's where you can provide information, because we're here to protect those that we care about. We're here to protect those that maybe you've just noticed. So do your part. If you see something, say something. Do something. We have to work together.
Yes, indeed. Protect the elderly.
Yes.
Yes, indeed.
All right. So let's see here. What other things can we do?
And again, if you have any questions, give us a call here, 312-738-1060 is the number.
Yes. Now, here's a popular one.
Identity theft.
How many times have you getting someone coming in and saying something
Every
about
day.
that? Every day.
Every day.
Every day.
Identity theft.
So, here's some information about identity theft.
It's about 16.7 million people are victims of identity theft in 2017. There were nearly 3 million reports of fraud, identity theft, and other reports to the FTC in 2018.
Yes.
So
that's a large number.
It's a big problem.
Yes. And so here's the examples. Here are some examples and impact of identity theft. You want to pull up that chart?
Sure. So you have examples and impact of identity theft, examples of misuse, and the impact on the victims.
Yes. And then the interesting thing about it, like I've had people open up a credit card in my name, and all of a sudden I get a bill and I'm going, when did this happen?
Yep.
And so this just shows you examples of misuse and how it affects the victims.
Yes.
Because it's going to affect your credit, public benefits, medical care. You'll get harassed by the debt collectors. There are lawsuits. Then you have stress, anxiety, embarrassment.
Yeah.
Now, the interesting thing, let me tell you, I remember I was talking to someone who lived here in Illinois. She said because of identity theft, someone bought a whole house in Texas.
Oh, wow. Not a whole house.
A whole house in Texas. Oh, it looks like we have a caller.
Hey, caller, you there?
Yeah. Hi.
How you doing?
I'm all right. So, my dad died, and he's got no kids or wife. Can I get that burial benefit from him?
How old are you?
35.
Well, when someone passes away, the only way you can be eligible for a death benefit would be if the individual is the spouse of, or the child 18 or under, or a disabled adult child.
Okay, what would make me disabled?
Well, you would need to come into the Social Security office and take an application, and then they would make that determination. But you would let them know whatever your alien condition is, and they would determine if that's something that is considered a disability.
Right, because normally with Social Security, if you're considered disabled as a child, you have to be identified as disabled through our organization prior to age 22.
Okay, thanks.
Okay, thanks for giving us a call.
Thank you.
All right. And so we're not saying that you can't apply for benefits for under a deceased parent's number, but again, there are rules and regulations. Again, you have to have your disability as a child, and work is going to become a factor. And if you have married, that's going to be a factor as well.
Yeah. So, if you have like specific questions, because I know you're just asking a general question to us, and we're on TV, so we can't really look up information. We don't really know your history. You can always contact us at 1-800-772-1213. That's 1-800-772-1213. And you can ask the question there, and they can pull up information. Okay?
But again, that was another good question.
That was a good question.
All right,
Definitely.
today.
Let's see here. So, now what good things do we do when it comes to your Social Security number as far as Social Security?
Social Security Administration protects your Social Security number and keeps your records confidential. You should be careful about sharing your number, even when asked for it. And you keep your card and other documents that show your Social Security number in a safe place. Do not routinely carry your card or other documents display your number.
Now, this is so true. Do not walk around with your Social Security card. Stop.
Oh, we're on a roll.
We have another caller.
Okay, caller, are you there?
Yes, I think it's me. Yes.
It's you.
A couple of weeks ago, I was listening. I never listened to this before, but I just touched the tail end of it.
and they were saying something about an increase in Social Security benefits. Am I getting that wrong?
An increase in Social Security benefits. You must be talking about that cost of living increase.
Oh, and I said it wrong, so we got to make sure we give them the right.
Yeah, it's the cost of living increase that is going to happen. It's 1.6% that you're going to
1.6.
receive. Woo woo!
A
Isn't
whole
that exciting?
1.6%. Yes, indeed.
Yes. So, yes, you are going to get an increase next year.
Isn't that what comes every year, though?
You should see that in your January payment.
Okay. So
Okay?
It's pretty much. Okay, it's pretty much what it always is. Okay, thank you very much.
Okay.
You're absolutely welcome, caller. Thank you for calling. Oh, that was a great call.
And we were talking about identity theft.
Yeah, we were.
Yeah.
And we're telling people why they should not carry their Social Security card in their wallet or in their pocket, because it never fails. You'll lose it, and then people have access to that information. They have your name on there, and they have the number. So please stop carrying those cards. Most of the time, you already have them memorized. So just know your number.
Yeah. And in the event that you do recognize fraudulent activity, you have to get proof of the fraudulent activity and do the proper things to have that prevented and bring that information. If it's something that's legal, bring that information into the office, and we'll see what we can do about that.
Okay, looks
We got
like
another caller on the phone?
I know, caller.
All right. Caller, you there?
Yeah, I sure am. Good evening.
Hi. How are
This
you?
is Paula. Happy Thanksgiving to you.
Aw, happy
Happy Thanksgiving.
Thanksgiving.
You look beautiful on TV. Hey.
Oh,
Hey.
well,
Like
thank
that.
you.
That's I know you're the real Social Security. You're no fake robocall on the telephone. Ooh, they've been coming
not
through.
us.
But anyhow, I've got a question. I have been retired since I'm 62. I got out early. I've been a waitress all my life. I got a little tired, so I started retired at 62. And next month I'm going to be 65. Ooh,
right.
praise the Lord! I can still dance. Hey. But anyhow, I'm wondering when is the next step of my Social Security? What's the big one now? 66 years old, 67. What happens now? As far as my income coming in on my little Social Security check every month. Do I get older? Do I get more? Like the last caller said. Woo!
Yes, you do. Well, you can start receiving your Social Security as early as 62.
I have been.
Okay, so wherever you start receiving your Social Security, that's where you're locked in. Only increases that happen after that are the cost of living increases.
Right, which you're getting a 1.6%, and you should see that in your January payment.
That sounds like good $2-3 to me. I'll take it. Hey.
Take it.
Yes,
Take it.
yes.
But what my question is to you, what happens when I'm 66 or 67 and all that?
You will be 66 and 67 and all that.
Yeah.
You get to celebrate another birthday.
Yes, indeed.
Don't get smart up there, smarty pants. I give you sweet.
So what
sweet
happens
potato
is- So here's a question, because you said you're 65 now?
I'm going to be in January. Yes, ma'am.
Okay, so now what'll happen is your Medicare kick in.
Oh, it's already kicked in, baby. It's kicked in. I'm in the lock. Oh,
All
yes,
right.
baby.
So
my
good
Social
for
Security
you.
got my digits. Oh, yeah.
Good for
I've done
you.
it right.
And
Yeah.
now understand, whenever you collect benefits before your full retirement age, that is what, like Michael said, you're locked into that number. And the only time it increases is if there's a cost of living increase.
Right.
Okay.
So I ain't got too much more, but whatever I got coming, the Medicare, the Medicaid, so I'm pretty good then.
Oh.
And tell Social Security I said thank you for the $3. And y'all have a blessed Thanksgiving and a safe one.
Oh,
You
too.
have a wonderful Thanksgiving also.
No
and happy
problem.
holidays coming up.
Thank you, SSI. Bye-bye now.
Thank you. All right. So, you know what? We talked about fraud. We talked about elder abuse. We had some great calls. And guess what, guys?
It's over.
He said it's over. Well, we have to kill just a little more time. Wait, we don't have another caller, do we? Oh, okay. So, let's wrap this up.
Let's wrap this up.
Yeah. So, you know what, Michael? It was a pleasure being here.
Yes, indeed. My name is Michael Bill.
Michael Bill, he doesn't want to give out his office because he doesn't want you all following him. To have 100 people coming down there asking for Michael.
It's been a pleasure being here with you guys
Yeah.
today.
And I'm Nicole Joseph, the Public Affairs Specialist. And thank you all for watching CAN TV. We're here every Wednesday until December 18th from 4:30 to 5:25. Thank you guys for the wonderful calls and have a happy holiday.
Good night.
Good night.